This is what's left of the Doctors Without Borders trauma centre in Kunduz. Staff say the hospital was hit several times during a sustained bombing attack. The airstrike started at 2 o'clock in the morning local time, when most of the hospital's more than 100 patients would have been asleep. In a statement, NATO says US forces conducted an airstrike in Kunduz city against individuals threatening force. The strike may have resulted in collateral damage to a nearby medical facility. This incident is under investigation. Afghan government forces, backed by US airstrikes and NATO special forces, have been fighting to regain control of the northern city from Taliban fighters. But the bombing of the hospital is a reminder of how imprecise airstrikes can be. Doctors Without Borders said in a statement, "We are deeply shocked by the attack, the killing of our staff and patients, and the heavy toll it's inflicted on healthcare in Kunduz. We urge all parties to respect the safety of health facilities and staff." The loss of Kunduz was one of the biggest military victories achieved by Taliban fighters since the overthrow of the Taliban government in 2001. On Thursday, the Afghan army said they'd retaken the strategic northern city, but the Taliban claim that's not the case, that they've just withdrawn to other neighbouring provinces before a counterattack. Aid workers fear many more civilians may be killed or injured as the fighting continues.
I
live in Kunduz province. There are injured people in the streets. Our shops are being burned. I urge both sides, the Taliban and the government, to stop the fighting so the wounded can be taken to hospital and everyone else can leave.
The Doctors Without Borders hospital is the only specialist trauma centre in northeastern Afghanistan. The damage caused by the bombing attack is a blow to people who rely on the free life-saving treatment the hospital provides. Victoria Gatenby, Al Jazeera.